Welcome to the Medical Staff Voice Live. I'm Dr. Stan Frochtzwajg, Chief Medical Officer at Community Memorial Health System. And I'm joined today by Dr. Joseph Eisner. Welcome, Dr. Eisner. Thank you so much for being here.
Thanks, Dr. Frochtzwajg.
Sure, welcome. I would like to thank you for joining us today so our medical staff and community can learn more about your practice. In order to do so, we have a few questions that will enlighten us and give us better insight to you and your specialty. First of all, I'm interested in, tell me a little bit about yourself, about where you're from, where you were trained, and what brought you to Ventura.
All right. Well, I grew up in Orange County when it used to be like Ventura, a lot of avocados and oranges. And then just like all of us, training brought me to 1,000 places. I went to Berkeley for undergrad, studied integrative biology, kind of focused on neuroscience and where plants and humans kind of meet. Then I didn't want to go straight to medical school. I wanted to kind of have some kind of experience in life. So I had a 9-to-5 kind of job where I worked in children's literacy in a nonprofit, kind of combination of desk work, going out to doctor's offices, helping children under 5 kind of get their first reading experience, especially in developing communities, in like underserved communities. And then I went to med school at NYU, which is the only degree that has continued to increase in value as I've graduated. And it's now number 2, nothing to do with me, obviously. And then I went to residency at UCSD for general surgery.
Wow.
And when I was trying to find jobs, I needed 2 things. I needed an ocean with good surf and a great community, and I was lucky enough to find it here.
Ventura does seem to have a recurring theme of good surf. So I've heard that from a number of people.
Yeah.
What I'm also interested in is the medical staff would like to know, what procedures do you have to offer that our colleagues would be interested in? Mm-hmm. And also, what ages do you treat? I know for myself, having worked with you, interested in hearing about laparoscopic hernia repair, as well as a unique technique that you perform for hemorrhoidal treatment that I think is not spoken about much, but is suffered by many.
Oh, yes, for sure. General surgery, what I love about it is I do every part of the body. It could be breast cancer surgery, colorectal surgery, some small amounts of vascular surgery. Pretty much everything in the abdomen is how I describe it to my patients, except for brains and bones. That's other people's problems. When it comes to hernia surgery, I have kind of a focus in minimally invasive surgery. So a lot of times we talk about inguinal hernias and umbilical hernias. And at UCSD, we were kind of one of the leaders in NOTES surgery, which is natural orifice surgery, which was very flashy, no longer done, but those techniques that we use to essentially take out an appendix through the mouth, or you take out a gallbladder through the vagina, all of my mentors use those techniques to maximize small incision surgery for the largest surgery possible. So in short, essentially, I really enjoy the making it as hard as possible on me, so the patient has a very rapid recovery. And laparoscopic surgery really allows me to do that.
Absolutely.
And then for the unspoken problem, hemorrhoids, which honestly, anything that's wrong with someone's bottom is usually called a hemorrhoid. And I'd say 50% of the time it's actually a hemorrhoid. But for what is actually a hemorrhoid, I do something called a transanal hemorrhoidal dearterialization, which is an extremely long and fancy word for, I kind of bunch up all the tissue in the anal canal that's falling down, and I also decrease the inflow of blood, which is hemorrhoids or blood vessels. And so by kind of treating, pulling the tissue back into the bottom and decreasing the blood flow, you kind of treat it in 2 ways. And what's beautiful about it is it hurts a lot less, the recovery is faster, the outcomes are essentially equivalent to the traditional one where a patient's friend told them that they had hemorrhoid surgery and it was the worst experience of their life. And this is the way we try to avoid that. So I've been teaching it to all the surgeons in the community because it wasn't really known. And it's taken off pretty well.
So glad to hear that. What ages do you see? What's kind of like your boundaries? I
usually treat anywhere from 2 years old to 102 years old. I mean, general surgery generally means you meet everybody. I do mostly appendicitis-based issues for pediatric patients, some small hernias. And general surgery, honestly, we meet most people oftentimes in an emergency setting towards the end of their life because there's very complex issues that arise. And so I find myself helping patients make the decisions that they want in those emergent situations, sometimes towards the end of their life, because something usually goes bad in the abdomen eventually.
And it sounds like not only the procedures they want, but the procedures they need.
Yeah, exactly. I mean, I think we're always trained to try to help people. And as surgeons, we like to do things to people because that's what we're good at. Primary care, you're a better balanced person overall, and you have a better balanced approach to treating people. Surgeons, we feel bad when we can't do something, and so we generally do things to people. My training has been, and more modern training has been, think about not what you're going to do right now, but how it's going to affect the patient later. Sure, you can fix a hole in a colon or remove that part of the colon, but how is that going to affect the patient's life? If they're going to only live a month after that and they're just going to have a very difficult end of life with a big incision, you're not really doing them a lot of help. So the way I think about it is helping people maximize what time they have left in those kind of emergent situations.
Well, I have noticed working with you that you not only excel at surgical technique, but you excel at the other half, which is surgical judgment. So that's really important.
That's very kind of you.
Can you tell me where your practice is located?
First, let me give you this dollar bill for that nice compliment. I essentially practice over most of Ventura County. We have offices in Oxnard and here across the street from CMH and on Brent Street. My partners in my group, we actually treat or have offices in Thousand Oaks and Camarillo.
Thank you. You gave me a little lead on the surf being good here. So my next question is really, what are your outside interests and hobbies? And I imagine surfing is one of them.
Yeah, I mean, I grew up surfing. My dad did not know how to surf. So it was purely just me going out in the water and him with binoculars making sure I didn't drown, because honestly, he's not even that good of a swimmer so I don't know what he was going to do to maybe go for some help. He's a East Coast general surgeon. The concept of going out of big waves is very foreign to him.
I understand. Anything else?
I really love camping. I just love being outdoors, rock climbing. I sometimes do, we call it multi-pitch rock climbing, where you essentially, one pitch is 100 yards of rope, and you go up 100 yards, and then your colleague goes up the next 100 yards, and then you keep going up until you hit the top of the mountain.
So you don't have your feet on the ground any longer, is that right?
No, it's on a wall, I guess.
I have to admit, some of the most fun I have is with this final segment. It kind of lightens things up a little bit, and it's called This or That. So let's start at the top.
All right.
Having your own private jet or your own private island?
I'm more of an adventure kind of person, and so the idea of jetting around sounds incredible. Surfers, you think they just want to be on some island and catch the same wave over and over. I like the idea of meeting new people, new cultures, new food.
Nice. Would you prefer to have the ability to read minds or ability to see the future?
I think in the interests of HIPAA, I would say just see in the future.
I think that's a wise response. Free gasoline for 25 years or have your dream car?
I think it'd be a car, because I got to think about the environment. I don't want to abuse too much gasoline.
Wow, that is such a great answer. A ninja or being a pirate?
I think a pirate, because I mean, again, it's the adventure.
Yeah, I get that. Become president of the United States or a world famous surgeon?
My dad used to tell me he would rather be a simple surgeon and doesn't want to be famous or well known. I just want to treat normal people with normal problems, I have faith in my own stuff, but I don't want to treat famous people. I want to just treat you and me, regular people. So I guess I'll just be resident.
Very good. Very good. Well, thank you for tuning in to learn more about Dr. Eisner. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhshealth.org. And be sure to like and subscribe for more from your community health system. Thank you so much, Dr. Eisner.
It was a pleasure being here.